I'd like to now turn it over to Dr. Frank Martino from William Osler Health System to say a few words.
Thank you, and thank you for inviting us to this town hall. I want to thank Dr. Lowe for providing some very rational and important information to those on the phone and who are listening in. I think that information is more than just relevant. It's crucial to the success as we affront the challenges that the coronavirus pandemic has created. I also want to take a minute to thank Mayor Brown and the City of Brampton in bringing this teleconference telephone town hall together. I think one of the elements of this crisis is communication. Many of you will remember SARS, and during SARS, we didn't have social media and we didn't have smartphones, and we didn't have to deal with a lot of misinformation or incorrect information. I think communicating effectively with the science behind that communication is extremely important. I want to reflect on what Mayor Brown said about speed trumps perfection. I think we all know that, and we've seen the way this very virulent infection has caused significant death and morbidity around the world. And at present, Europe is the hot spot, but we worry about our border to the south. And we know that we here in Canada need to do our best to employ a lot of those tactics that Dr. Lowe had elucidated in his brief remarks about social distancing, about hand washing, about not socializing in large groups. At Osler, we've now recognized that an area of healthcare that we have needed to evolve over the years is virtual care, is speaking to healthcare providers through your smartphone, on Skype, speaking to them over the phone, and having those virtual encounters. Maybe, if anything, the COVID-19 crisis will allow us to further embrace virtual care. We've seen about 19 cases diagnosed through either our assessment center or at one of the 3 Osler sites. This is a rapidly evolving crisis, and we at the hospital want to advise the patients and citizens of our region that this is a safe place to come to receive care. We're working with public health and other healthcare and government partners really to monitor the situation and make sure we're following the latest direction, and really to advise everyone to practice healthy and safe distancing and prevent this crisis from evolving further. The health and safety of staff, physicians, our volunteers, our students who no longer are with us, they've been advised to also stay home. Our patients and families of our community is really our top priority. We recognize that the community we serve is concerned about their health and the health of their loved ones, and we want them to know that we're here for them, that our doors are still open. We have ramped down significantly with regards to our services, and we did this because we anticipate that this is not going to be a flight in infection, but one that will be quite profound. In doing so, what we've done is we've canceled elective surgery and other elective and non-urgent emergent procedures and clinics, but we have maintained those important urgent and emergent clinics that service the patients of the community, that sustain our emergency department and sustain our inpatient admitted patients as they discharge out of the hospital and go into the community to continue their spectrum of recovery. We recognized we needed to do this to create capacity in our critical care areas, capacity in our inpatient beds, as we anticipate that this crisis may require those services. In doing so, it has allowed us to redeploy a lot of our staff to those critical and anticipated needs of the community. We've also changed our visitor policy. We recognize that that will be crucial in managing the patients within our 4 walls and also those in the community. Hospitals are where infections lie, and we want to make sure that we're not a seed that produces more of the infection and pandemic. We've also instituted today a policy that our staff who've traveled outside of Osler, outside of Canada, will need to isolate themselves for 14 days upon return to the Brampton and region. In doing so, we believe we are protecting both them and our other employees. They will self-monitor at home and isolate themselves and advise our Department of Occupational Health if they were to acquire any symptoms. I believe that many of you are aware of our Osler Assessment Center. It has been extremely busy. Our plan is to open a second assessment center at our Etobicoke campus, but we're very proud of the speed with which we created and brought this center together. It is there to provide a place where citizens from our region can go and be assessed. Many are afraid. They appear in line simply because they've had maybe non-specific symptoms and are concerned that they may have acquired the infection. I want to reiterate what the criteria are for testing and for visiting the assessment center. So if you have mild symptoms of an upper respiratory infection, flu-like illness, and any of the following, a fever greater than or equal to 38 degrees Celsius, if you have underlying immunocompromised conditions, are taking chemotherapy, for instance, you have HIV, AIDS, or you're a dialysis patient, for instance, we encourage you to come to the center and be assessed. And especially if you're over the age of 60, we know that our seniors, our geriatric patients, are at extremely high risk of becoming infected and having a significantly negative course with regards to this illness. The vast majority of patients, upwards of 80 to 85% of patients, will have a mild respiratory illness. It is those patients that are elderly and those with significant comorbidities and are either immune suppressed or on chemotherapy. It is those patients that then evolve significant complications of their infection that can sometimes cause death. If you've been referred by public health because you may have come in contact or of a confirmed or probable case of COVID-19, you should also be attending the center. And if you're a healthcare worker in any acute long-term care or primary care setting, we in fact are trying to prioritize those individuals so that we can continue to allow them to function within the community and provide healthcare to their families, to their patients, and not create any risk for their families. We used to have the category of pregnant women. That has been taken off, and some of the research is showing that, in fact, children and pregnant patients are not at increased risk of COVID-19. We're going to continue to work with our patients, especially those who've had their surgery canceled or their clinic appointment canceled. We'll continue to work in the weeks and months to come to make sure that we reschedule their appointments as we evolve through this crisis. We'll work with our patients who are receiving treatment and assure that that treatment is not interrupted, especially if it is chemotherapy and dialysis, our cardiac patients. So what we are actually doing is triaging patients appropriately and making sure that we are managing those patients that require acute care in a timely and urgent manner, and then those that are here for elective procedures, that we're also addressing their needs and timing those at a later date as we resolve out of this crisis. I think it's extremely important to recognize that you have a family of caregivers here at Osler that are committed to the health of this community. We'll continue to be here, and I've been more than impressed. I've been extremely proud and privileged to work with a community of healthcare providers, both at Osler and our partners, our community partners, ambulance, fire, police, and other healthcare providers And I've been extremely proud to see how they've all gathered in and leaned in to really give that extra and going beyond in delivering care for this community. When we opened the assessment center, it was quite interesting. General surgeons, family physicians in the community stepped up and said, I'd like to be there. I'd like to be part of this, and I want to help out in any way I can. Many of our physicians now have had a lot of their services canceled, are going to be redeployed, and hopefully we will not see a significant degree of mortality and morbidity from this infection, but we'll be there if you need us. And we will certainly make sure that we have our critical care and emergency services prepared to address whatever this virus delivers.
Thank you, Dr. Martino.
Well, thank you. Yeah, thank you so much, Dr. Martino. And to Brampton residents, just so you know, Dr. Frank Martino leading the charge at William Osler, Dr. Lawrence Lowe, who is leading the charge for the Peel Public Health. These are two of the smartest health minds in Peel region, and grateful that they're taking the time tonight to let people on the call know. Once again, this is Mayor Brown speaking. We have 13,562 Brampton residents on the call right now, so this is terrific. I appreciate the fact that everyone is very interested in this topic. It affects all of our lives. We have extended the call from, it was going to end at 6:30. We're going to go right to 7 p.m. because it's taking a little bit longer than anticipated to have the briefs from all the experts, and then we're going to get into questions. So thank you so much, Dr. Martino, and looking forward to the next brief.
Thank you, Mayor Brown. Again, it's Bill Boyce, Fire Chief here with the City of Brampton. And I just want to remind everybody that to ask a question, please press *3 on your phone. And as we move forward, I want to turn it over to one of my emergency services colleagues, Deputy Chief Randy Patrick from Peel Regional Police, for a brief update.
Thank you, Chief, and thank you, Mayor Brown, for the opportunity for Peel Regional Police to provide the community with a brief update on our response to this crisis. I can tell you that initially our activities included setting up a COVID-19 response committee within our organization, and that committee is made up of major stakeholders, including our emergency management team. This week, we have activated our Emergency Operations Center. We've also activated our Business Continuity and Pandemic Plan. And further to that, today we made the decision to close all of our public divisions with the exception of citizens wanting to report accidents at those divisions. And this is to prevent the spread of the virus any further, not just in the community, but in particular to our emergency responders, who we obviously need healthy so that they can continue to protect the public. We had also introduced the 14-day self-isolation policy for any of our staff members returning from international travel, as Dr. Martino had mentioned earlier, with the healthcare workers. And again, that's to protect both the public and our other first responders to keep them healthy. Also, anyone who is calling Peel Regional Police asking for a police response, in situations where we're able to, you can expect our call takers to ask screening questions of the caller to determine if there's any potential exposure risk to our officers when they're attending, so that they can use appropriate precautions before they actually get to the call. We continue as an organization to be part of the Region's Unified Command group meetings. We're also part of the Regional Emergency Management and Public Health Conference calls. And I can also tell you that here at Peel Police, we have a very comprehensive business continuity plan, and that's to ensure that our staffing levels remain at acceptable levels, even with the very fluid situation and ever-changing needs of the community. We do have plans to ensure that we're able to deploy sufficient personnel to respond to that. And just wanted to give a brief update so that we can open this up to questions, but I can assure you that Peel Regional Police is committed to continue to work with our partners, not just in the health field, but certainly our emergency service partners, to help the community get through this crisis. So thank you very much.
Thank you, Deputy Patrick. It's Bill Boyce here, Fire Chief and moderator today, and I just want to give a brief update on what we're doing as your fire and emergency services providers. And I think the big thing that I want everybody to know is that we are ready, able to respond to any emergencies we get, despite some of the challenges that we're facing with this COVID crisis. So we have not changed any of our service delivery levels, and if you call 911 and there's a fire or emergency, our fire and emergency responders will be able to respond as we typically do. One thing I want to note is if you are calling 911 is that we ask it be done only for true emergencies. If you have questions related to this COVID emergency, that you call Telehealth Ontario or Peel, the Region of Peel and Peel Public Health, and those numbers can be found on the website. Also, we've put together an internal team of 10 different senior leaders that come together across the organization to make sure we're ready to deal with any of the challenges that come up with COVID. We've been working on this for a couple of months. We didn't just start the last few weeks. We are prepared with ordering extra personal protective equipment. We also took steps last week to make sure that we weren't doing any public events or public education to ensure that our first responders were protected and able to respond in any event or any emergency. We've also really enhanced the cleaning of our stations, of our apparatus, of our equipment, so that we're giving everybody the chance that works in the fire service to be protected to the greatest degree possible. And lastly, I want everybody to know that we are highly coordinated and collaborating with Peel Regional Police, with Peel Paramedics Services, with our other fire departments that surround us in the GTA to make sure we're doing everything we can, sharing resources, sharing information as we move through these challenging times. But I'll tell you, I know our staff, despite the difficult times, they are 100% committed to getting out there and serving the residents, and we will all get through this. So before, we have one more update, and that is Chief Peter Dundas of Peel Regional Paramedic Services. And then we're going to do a quick poll, and then we're going to get to your questions. And as the Mayor mentioned, we are going to stay on longer. We are going to go to 7 o'clock today to help kind of answer some of the questions that you may be having. Chief Dundas?
Thanks, Chief Boyce, and thank you, Mayor Brown, for allowing me to participate in this with the great residents of the City of Brampton. Peel paramedics are always ready and responding to any needs of the residents of Brampton or any person in the region of Peel. And in the pre-hospital setting, we are your healthcare provider. And our goal dealing with COVID is to ensure that our frontline paramedics remain as healthy as possible and staffing numbers remain at the levels that we anticipate from a delivery perspective. Our business continuity plan is fully in effect. We have locked down our main buildings to protect our employees from any potential exposure because as Deputy Chief Patrick and Chief Boyce have said, we need to keep our frontline officers, firefighters, and paramedics healthy throughout this event. Just a couple of points to residents is when you're calling for help and you need paramedics, you will be screened through the dispatch center, asked a variety of questions, and we need you to advise accordingly with respect to travel, fever, cough, sneeze, sore throat, etc. That will be conveyed to the paramedics. And if it's a positive screening, the paramedics will do screening again when they get to the scene, and they'll keep a 2 to 3 meter or a 6 to 9 foot distance away from you or your loved one while they do the screening, so they can determine what level of personal protective equipment they need to exercise before caring for you. There won't be delay. It's practiced regularly with the paramedics wearing personal protective equipment. And the thing you will notice differently is the variety of masks that they will be wearing. Some are white colored, some are rubberized color, masks, respirators, and others are over the head with a battery pack that provides positive air for certain individuals. This is a variety that we have in place to accommodate certain needs, and also with some, especially N95 masks, running short, we're looking at alternatives to keep our workers safe and yourself safe. So there will be double screening, but we're ready, we're able to take care of you. And please don't hesitate to call us. But please don't call paramedics to do COVID assessments. We are not able to do that. And please do not call paramedics to do any form of testing through swabs. We're not able to perform that. You will need, under the direction of your local public health, which is the Region of Peel, be directed to an assessment center. And the one at the Peel Memorial Integrated Health and Wellness Center is very busy, but it is being professionally run and being able to manage the volume of people there. So my message is, if you need us, call us, and we'll be there, ready to care for your healthcare needs.